Hello and welcome to Helios Skin, Hair and Laser Clinic. This is our YouTube channel. Today's interaction is going to be very special because it's going to be special for men. Now, whoever said that beauty is only restricted to women? Considering the products that are available today on the shelves, I think even men are becoming very conscious about the way they look. To talk about what are the various issues that men face and how they can also upkeep their skin and hair, I have with me Dr. Yamini from Helios, who's going to be sharing insights and inputs on how to take care of yourself, especially for men. Hello, doctor.
Hello,
How are you?
I'm good.
So, we are on men's special, two ladies talking about men. So, doctor, let me begin asking you, is there first a difference between the hair care that women follow versus what men follow?
Yes, there is a difference because the men hair is thicker than the women, and the medications and the topical lotions which we use for the men and the women are different. For example, the percentage differs. For minoxidil, if we use, it will be a little higher percentage and they'll be applying twice daily, whereas for the women of reproductive age group, we do not use certain products like finasteride. So there is a difference.
Nice. So, I mean, you said that there is a difference and men's hair is thicker. Sometimes it grows longer than women's hair also. So Doctor, like I mentioned in my introduction, there are a lot of products available on the retail market today, thanks to the social media or thanks to the development and the needs for people. So is it okay for a man to pick up something from a woman's choices or range of products?
There is a difference between the men products and the women products because the active ingredients are in a much higher concentration when compared to the women. And for men it is preferable to use a lotion or a gel. So there is a difference.
Okay. So I'm sure you've been seeing a lot of patients in your in your tenure or in your career. So what are the different types of issues do men come up with regard to their hair?
So the most common problems which men face is seborrheic dermatitis. Then they have androgenetic alopecia. They also have alopecia areata, where there's a patchy loss of hair in certain parts of the scalp. Can be also on the beard area or the mustache area. And they also develop folliculitis of the scalp also. So these are the most common ones which they come for.
Okay. So we're talking mostly about hair care now, doctor. So dandruff is something that not just women have. There are a lot of men also who have this particular problem. So what is dandruff? Because there is a lot of confusion between flakiness in the scalp or is it the same? I'm not aware myself. So it would be nice if you could tell us what is dandruff and how can somebody deal with this.
Okay, dandruff is basically there's excessive scaling of the scalp, and there's a when there is when they use excessive serums or lotions, it will develop a scalp buildup where there will not be any irritation associated with this. So we call that as a scalp buildup. And seborrheic dermatitis dandruff, it is because of the organism Malassezia, where there is greasy scales which can occur in the oily parts of the body, like the face, like the chest, the back, all those areas it can be more prominent.
Okay. So doctor, today we find a lot of young men, losing hair. It could be, receding hairline or probably premature baldness also. So why does this happen, and is there a way that they can take care of that, and is there a treatment available for premature balding?
Okay, this is the androgenetic alopecia. It can be genetic and sometimes it can also have environmental factors. So for androgenetic alopecia, we can divide the treatment at least by using topical lotions and oral medications, and also we can go for surgical methods. So when it comes to the topical, we can use minoxidil and or minoxidil with finasteride combination. And when it comes to the oral medications, we can supplement with multivitamins And we can also give them oral finasteride drug, which is also very helpful. And surgical methods, we can go for hair restoration methods like hair transplant. Recently, there's another type of treatment which is also available, which is a low-level light therapy, which can be done for these conditions.
Two things that you said caught my attention, Doctor. One is the multivitamins. So today there's a lot of advertisement on supplements. How safe is supplements recommended for somebody, and is it okay to take supplements like that?
Yes, it is okay to take supplements. Initially, we have to find the cause, whether there are various factors which can lead to this hair fall. It can be vitamin deficiency, it can be a low HB level, it can also be thyroid disorders. So it is better to take an investigation, see what they have, whether it's any of these, and it's better to go see a dermatologist and then start with multivitamins like biotin or iron supplements, or even zinc or anything we can start with.
And the other thing that caught my attention was the hair transplant, Doctor. Today it is definitely something that people are reaching out to and are taking it as let's say a cure for their treatment or difficulty, because losing hair is not very something that men would not really want to. Everybody wants to look good. So what is hair transplant, and how safe is it for one to go through this particular procedure?
Hair transplant is a good option for both men and women. So basically the principle is that the androgen hair which is on the back, we transplant it into the front area, and this can be topped up with minoxidil and oral finasteride medications also. So it is actually a very safe procedure. It should be done in sterile conditions, and it should be done by a dermatologist.
So, doctor, when somebody comes for a hair transplant, I'm sure there are some, prerequisites that as a dermatologist that you look for, and you would recommend this particular treatment. So, when should one come to you for a hair transplant? At what stage? I mean, can they come in, when they notice the slightest of balding that is happening, or is there, a period where they have to wait for and then come to you?
So when it comes to deciding whether when a patient can do hair transplant, it really depends upon the pattern of balding, and in any age group we can do, but too old people we really cannot do when they have this complete loss of hair and the central part and is completely gone. But they should have a reasonable hair in the back. That is, the donor site must be reasonably good to do a hair transplant.
Doctor, we've been talking about the hair on the head for a very long time. So men are very proud about their beard also, the kind of beard that they sport. So shaving is something that with all due respects to all men, is something that they have been doing right from the time they get to hold the razor at the first time. But not many still know that there is a right way of shaving. So, doctor, is there a right way to begin with, and do they have to really shave every day, or does that have an impact on their skin?
Yes, there is a right way to shave. So initially you should wet the skin so that that area becomes, the hair and the skin becomes soft. And following that, they can apply the shaving lotion or gel, which is not irritant to their skin. They have to choose that correctly, and you have to shave in the direction of the hair. And after that, again clean it, and then they can use any cream or lotion on top of it. So it is better to shave in the direction of the hair so that we can avoid a lot of folliculitis in that area, and sometimes it can become rough. Too much of that shaving also, it can become rough. And when it comes to whether they are supposed to shave daily, it depends upon the occupation they are in. If it's an office going person, they need to be trim and proper. They can do the shaving daily.
Because the razor on the skin every day can make the skin rough is something that is an age-old saying that people believe. So does that really have an impact?
So that is where we use that the shaving lotion or the cream, where we soften the skin. So that really helps to when we do the shaving, it really helps in softening the skin. So I think
there's no harm. Doctor, again continuing with beard, just to avoid that daily shave or shaping the beard, is there a aesthetic solution for that, for beard shaping and trimming of the beard?
So there are laser hair removal procedures which we can do for men, and that will reduce the thickness and also the density of the hair. So people who do not want to shave daily, they can definitely try laser hair removal. And there are patients who come and do laser hair removal not only on the face, they do it for the body parts also, like the chest area where they don't want. For example, for the people who are going to the gym and that bodybuilding, when they don't want the hair to be seen, they can come and get the laser hair removal done even for those areas.
Nice. So, doctor, thank you so much for sharing so much on the hair. Now let's get to the skin. So, how important is skin care for a man?
So, men's skin care is actually very important. So, first you have to assess the skin, and definitely the thickness differs from men to women. Men have a thicker hair, and for men, it is better you assess the skin, whether it's a oily skin, whether it's a dry skin, or it is a combination skin. And then depending upon that, they have to start using a proper sunscreen, a moisturizer, and they also have to take care when shaving. Their shaving technique also should be proper. It's better to men also start taking care of the skin is very good.
I hope men out there are listening to it. It's not very difficult to take care of your skin. You just have to moisturize and take care of it. So, doctor, how important is hydrating your skin for men? I know for women we talk a lot about drinking a lot of water and all that. So, is that rule applicable to men as well?
Yes, definitely. It is applicable to men. Whatever the women like, whatever they do, it is better the men also follow it, because it is applicable. Initially in those days, men, they did not take care of their skin, and now there's a lot of awareness which has come into through the social media. A lot of them are seeing the internet. A lot of videos have come out. It's to take care of the skin. It is better they also do it and hydrate it well.
So, doctor, having a bright skin, I don't want to use the word, fair, but having a bright skin is not just an obsession with women. I think men today also, would like to look brighter and, happier. But there's a lot of pigmentation that they face also, doctor, just like women. But women have those pigmentations that come in because of hormonal imbalance and things like that. Why do men have pigmentation, and how can one deal with that issue?
So pigmentation, we can classify it into different types. When it can be an environmental factor, for example, when they are exposed to too much of sunlight, it can just be a suntan. It can be a hormonal factor also, and it can also be a disease related. For example, if it is going to be a disease related, it can be post acne. They can get scars and pigmentation after acne. And another condition called as lichen planus pigmentosus, which is a medical condition. So unless you treat that medical condition, the pigmentation is not going to resolve completely. And even with medication, sometimes it doesn't resolve completely. So for all these type of pigmentation, we can give topical creams, and we can do chemical peels, and then we can do cosmetic procedures. So when it comes to the topical creams, we can give kojic acid, we can give azelaic acid. All those creams we can give, and definitely a sunscreen must be applied. And when it comes to cosmetic procedures, we can do chemical peels and also Q-switch laser. So these are the different treatment options which are available for pigmentation. It is better they consult the doctor, they assess the type of pigmentation they have, whether it is a superficial pigmentation which will just go off in creams, or it is a deep pigmentation which will need much more procedures than the superficial ones.
So, doctor, thank you so much. You've been giving so much of information about how to take care of the hair and the skin for men. My question to you now is, when should one come to a doctor? I know when it is a general physician, when you're feeling sick or when you have something which is symptomatic, we go. But to a dermatologist, when does one visit a dermatologist?
So, when you have a problem, or if you want to know and get to know about how to keep your skin well, and what are the creams or lotions or sunscreens you want to apply, instead of just going and looking into the internet and trying to take something out of the shelf, it is best you visit a dermatologist. They assess you whether you have a real disease condition, or whether it is just a scar, or whether it is due to your old age, where the hormones will act on the skin differently. So it is better you assess the skin and then meet a dermatologist and then get it right from there.
Thank you so much, Dr. Yamini, for sharing so much of information on skin and hair care. So I hope men out there, are watching this, and Dr. Yamini has definitely shared a lot of information on how to take care of your hair and your skin. It's not very complex. You just need a little time and effort. I hope this video has been helpful for you, and here's continuing to looking good. Thank you very much for watching.